I want you to picture a resume for a moment.
Okay.
You're the hiring manager for this massive, really high-stakes job.
Hmm.
Let's say safety inspector for thousands of vulnerable people. And you get this resume across your desk. At the very top, in bold, shiny letters, it says, World Leader.
That's the candidate everyone wants to hire. I mean, it sounds confident. It sounds established.
Right. It implies the gold standard,
Yeah.
the best of the best. And that is exactly how a 2025 review describes British Columbia's approach to home sharing. It calls the province a world leader in this model.
It's a fantastic title. It really suggests that, other countries should be looking at BC and taking notes.
Exactly. But today, we aren't just looking at the headline. We are checking the references. We're digging into the filing cabinet. Because sitting right next to that world leader claim is another document, a much grittier, heavier document that tells a very different story.
And you're talking about the June 2021 audit report, the one from the Auditor General of British Columbia.
We'll just call it the OAG report. And let me tell you, the picture this audit paints,
Yeah.
it is not world leader. It barely qualifies as administrative functionary.
It's such a jarring contrast. I mean, the Auditor General really didn't mince words. Their conclusion in 2021 was that Community Living BC, that's the Crown Corporation responsible for all this,
The LBC, yeah.
had not implemented a monitoring framework.
Not implemented. Just like, let that hang there for a second.
It's explicitly what they said. They found that the government couldn't ensure providers were aligning with quality of life outcomes or even, complying with basic safety standards.
So our mission today is to figure out how we bridge that gap. How do you get from a scathing, not implemented audit in 2021 to a world leader claim just a few years later?
And maybe more importantly, does the evidence in this audit suggest the foundation was even there to begin with?
Exactly.
To answer that, we have to look at the receipts. But, before we get into the spreadsheets and the policy failures, I think we really need to ground this. We need to talk about the humans involved here.
Right. Because home sharing sounds like a cozy Airbnb arrangement or maybe, I don't know, a student exchange program. That is not what this is.
No, not at all. This is a life support system. During the audit period, which was 2018 to 2019, this system covered about 4,200 people. And who are they?
Well, these are adults with developmental and intellectual disabilities. The audit itself describes them as vulnerable, isolated, and unable to advocate for themselves.
So they're living in a provider's private home.
They rely on that provider for everything: food, shelter, emotional support, safety, transportation.
Which means the power dynamic is incredibly skewed. You're living in someone else's house, and you're relying on them for your most basic needs.
Completely. And if something goes wrong in that home, if there's neglect or, just a lack of care, the resident often lacks the capacity or the means to just pick up the phone and call for help.
So the monitoring is everything.
It is the only thing that matters. It's the safety net. If the government isn't checking, then nobody is checking. And that leads to a crucial distinction for this deep dive. The Auditor General didn't, go knock on doors and inspect the bedrooms, right? They weren't checking if the sheets were clean.
No, and that's so important to understand. The OAG didn't audit the homes. They didn't even audit the agencies that run the homes. They audited CLBC, the government body.
So the question wasn't, is the soup hot?
The question was, does the kitchen manager actually have a system in place to check if the soup is hot?
And the answer was, they didn't really have a thermometer.
In a lot of cases, they didn't even have a checklist for the thermometer.
Okay, I want to rewind a bit here. Because usually, when we see a scathing government audit like this, the defense is always the same.
Oh yeah, we didn't know.
This caught us by surprise. We are shocked to find this problem. But looking at the timeline and the documents, that defense really doesn't fly here.
Not even close. This wasn't a sudden discovery. This wasn't a case where the Auditor General walked in and, found some hidden problem.
Right.
The OAG report is very specific about the history. It notes that CLBC evaluated its own monitoring framework 3 separate times between 2013 and 2016.
3 times in 3 years.
Yes.
That sounds like someone who keeps checking the engine light because they know the car is making a weird noise.
That's a great way to put it. You don't audit yourself 3 times in 3 years if everything is running smoothly. And on top of that, they had a separate quality assurance project running in 2017 and 2018.
Okay, so they knew there were issues.
They definitely knew. But here is the kicker. The audit found that despite all these reviews, despite all the internal hand-wringing in the committees, the recommendations were not responded to or not fully implemented.
Not fully implemented. I feel like that phrase is going to haunt us today.
It is the defining theme of this entire report, and nowhere is that clearer than in the 5-year plan from May 2015. I actually laughed out loud when I read the details of this thing because it is just a masterclass in bureaucratic hedging.
Oh, I saw this in the source docs. This is the CLBC Home Share Review response. This was supposed to be the big roadmap for fixing the system, right? The big fix.
Supposed to be. But if you read the fine print, the document explicitly describes itself as a working document.
A working document.
And it says actions may be amended.
That sounds so non-committal. It's like writing a grocery list, but saying, I might buy milk or I might not. It's a working concept.
It's incredibly flexible. It basically says, here is what we might do unless, we decide not to. And we're not talking about pocket change here. This plan mentioned investments of nearly $120 million.
Wow.
This is a massive segment of the social care budget.
$120 million. And yet, when the auditors looked for the detailed work plans, the how and when of spending that money, what did they find?
They found TBD.
To be decided.
Specifically regarding timelines for key items like rates. The plan literally said the work plans were not developed and the timelines were TBD.
I'm just trying to imagine going to a bank for a loan. I need $120 million for a massive construction project.
Yeah.
Okay, when will you finish it? To be decided.
You would not get the loan. You'd be laughed out of the building. But in government, this creates a convenient loop. You have a plan to make a plan. You get credit for having the plan, but because the timelines are TBB, you can never technically be late.
And that is how you get to 2021 with an auditor saying nothing has been implemented.
Exactly.
So we have a history of planning to plan. Now I want to shift gears to the actual contract, the piece of paper that connects the government to the person running the home. Because there seems to be a huge gap here between what's written on the paper and what happens in reality.
This brings us to Schedule A. It sounds boring, it sounds like tax code, but it's actually the heart of the moral obligation here.
Okay.
Schedule A requires providers to align their services to further quality of life outcomes.
Okay, so we aren't just talking about, is the fire alarm working or is there food in the fridge? We were talking about emotional well-being, social inclusion, rights, self-determination.
Yes, the stuff that makes life actually worth living.
The stuff that distinguishes a home from a storage facility.
Exactly. But here's the problem the audit found. CLBC required providers to align with these outcomes, but CLBC never defined what align meant.
Wait, so the contract says you must ensure emotional well-being, but there's no definition of what that looks like.
And no way to measure it. There were no benchmarks, no scoring system. So if I'm a monitor and I walk into a home and the resident seems okay, but maybe they never leave the house and they have no friends and they just watch TV all day, can I say the provider is failing?
I guess not. I mean, if emotional well-being is just a vibe, the provider could just say, well, he seems happy to me.
Precisely. It becomes a matter of opinion. The audit calls this operationally invisible. The requirement exists on paper to make everyone feel good, to make the government look like a world leader. But out in the field, it's unenforceable because nobody knows what the measuring stick is.
Well, it's really disturbing. But there's another structural issue here that I found even more confusing. The notes referred to an agency blind spot. Can you break down how this system is actually structured?
Yeah.
Because it's not just the government paying a homeowner, is it?
Not usually, no. There are two models. The direct model is simple. CLBC signs a contract directly with the person providing the care.
Okay.
And CLBC monitors that person. That makes sense.
Straightforward.
But that's the minority. The majority of the sector, about 63% back in 2015, is agency coordinated. In this model, CLBC pays a third-party agency. The agency then subcontracts the care to the home provider.
So it's a middleman structure.
Right. And the theory is sound. The agency monitors the home and CLBC monitors the agency. Delegation.
That sounds standard. Like general contractor. You hire general contractor, they hire the electrician. You trust the contractor to check the electrician's work.
It is standard if you actually check the contractor's work. The audit found that CLBC's monitoring of these agencies focused almost entirely on their internal processes.
So they were checking the paperwork.
They checked if the agency had the right insurance, the right policy manuals, the right filing cabinets. They were checking the office. They were not checking if the agency was actually monitoring the homes.
So using your construction analogy, I hire a general contractor. I go to his office. I see he has a nice desk and a valid license. I say, great job. But I never actually go to the job site to see if the electrician installed the wiring correctly.
And you don't even ask the general contractor for proof that he went to the job site. The audit found CLBC had not developed tools to verify that agencies were monitoring their subcontractors against the standards.
So CLBC assumes the agency is doing the work. And the agency knows CLBC isn't really looking at the homes.
It creates a vacuum, a blind spot where the actual resident, the person living in the basement suite, just disappears from the government's line of sight. And remember, this is the world leader model.
It's unnerving. But if the paper failures are unnerving, the data failures are where this starts to feel, well, negligent. I know that's a heavy word.
It's a heavy word, but when you look at the data gaps, it's hard to find a better one. The OAG report bluntly stated that CLBC lacked accurate and complete data regarding site visits and follow-ups.
Lack data is polite auditor speak for they didn't know what was going on.
Okay, let's look at critical incidents. This is the most serious metric you have.
Okay.
These aren't the resident didn't like dinner. These are injuries, aggression, medical emergencies, police involvement. In the 2018-2019 fiscal year, there were 1,594 critical incidents reported.
That's 4 or 5 every single day.
It is. And CLBC policy says that for the really serious ones, there must be a mandatory follow-up within 14 days. That is the safety rule.
That seems reasonable. You have 2 weeks to check in, make sure everyone is safe, make sure it won't happen again.
But the audit found a glitch. The computer system CLBC used did not capture the date CLBC was notified.
Wait, it didn't record the start date.
No.
But how do you measure 14 days if you don't know when day 1 is?
You can't. It is mathematically impossible. The audit points this out. CLBC could not prove they met the 14-day deadline for any of the 150 mandatory follow-ups because the clock never officially started in their database.
That is just a black hole. You have almost 1,600 incidents, and for the most serious ones, the government cannot prove they checked on the person in a timely manner. How does a database even get built without a date received field?
That's the question, and it raises a bigger behavioral question. If the system doesn't track the deadline, does the staff feel the pressure to meet it? Systems drive behavior. If the clock isn't ticking, urgency just evaporates.
So the database is empty, but the Auditor General didn't stop there. They did what good auditors do. They went and pulled the physical files. They looked at the actual receipts.
They pulled a sample of 49 files. Now, 49 might sound small compared to 4,200 people, but in auditing, a random sample tells you a lot about the health of the whole system.
Right.
And the numbers they found in those 49 files are, well, they explain the not implemented grade.
Let's walk through the stats. Start with the basics. Site visits. Did someone even go to the house?
In the sample, site visits were conducted in only 63% of the files.
So nearly 40% of the time, nobody showed up at all.
Nobody showed up. And of the 63% where they did show up, get this, only 35% were done on time.
35% on time. If I did my job on time 35% of the time, I wouldn't have a podcast.
It gets worse. Let's look at follow-up letters. So a monitor visits, sees a problem, and sends a letter saying, fix this.
Okay, so the problem is identified. Action is being taken.
Well, follow-up letters were sent in 74% of cases where they were needed. Better. But only 48% were sent on time.
So half the time, the instruction to fix a potential safety issue arrives late.
But here is the final layer of failure, and this is the one that really gets me. This is the bureaucracy over results moment.
Okay.
Even when a letter was sent, even if it was late, CLBC did not track the implementation of the action items.
Wait, hold on. So they send a letter saying you need to fix the handrail on the stairs?
Yeah.
And then nothing.
They didn't close the loop. There was no systematic tracking to see if the provider actually fixed the handrail. The act of sending the letter was treated as the solution.
I sent the letter, my job is done.
Yeah.
Meanwhile, the handrail is still broken and someone could fall down the stairs.
Exactly. And when you combine that with what we discussed earlier, the lack of quality of life definitions, you see the full picture of the failure.
Yeah.
You can't measure the soft stuff, happiness, inclusion, because you haven't defined it. And you aren't fixing the hard safety stuff because you aren't checking if the work got done.
And this brings us right back to where we started, the world leader paradox. When you read this 2021 audit, it really feels like a system in crisis. But then we have this 2025 review praising the model. How do we reconcile that?
It's difficult. I mean, the system may have evolved since 2021. The notes say CLBC accepted all 5 recommendations from this audit. They promised to fix it.
Right.
But we have to look at the history.
The not sudden history.
Exactly.
Yeah.
They had issues in 2013. They had issues in 2015. They had issues in 2016. In every single one of those cases, there were plans, there were working documents, there were acceptances of recommendations. And yet 2021 revealed the same core holes.
It's a cycle.
Yeah.
Acceptance, partial implementation, drift, new audit, repeat.
So when we hear world leader in 2025, we have to ask, is that title based on the philosophy of the model, which is admittedly beautiful, the idea of inclusion in a community, or is it based on the operational reality of the oversight? Because this audit shows that good intentions don't keep people safe. Checklists, data, and rigorous follow-up keep people safe.
Which brings me to the listener. Why should you care? Maybe you don't have a family member in home share. Maybe this feels like, I don't know, administrative trivia. Oh, the government is bad at paperwork. What else is new?
It feels niche until you realize that vulnerability is just a matter of timing. Through a car accident, a stroke, dementia, or just aging, any one of us can cross that line. We can all become the person who cannot advocate for themselves.
That's a terrifying thought. You wake up one day and you are one of the 4,200.
And if that happens, you are entirely reliant on the state's monitoring framework. You don't want that framework to be a working document with TBD timelines.
No.
You want to know that when a critical incident happens, the clock starts ticking immediately. You want to know that someone is checking the handrail.
You want proof, not just plans.
Exactly. This audit is a reminder that the social safety net isn't woven out of good vibes. It's woven out of boring, rigorous administrative oversight. And when that oversight fails, the net breaks.
CLBC accepted the recommendations. They said, we will fix this. But based on what we've seen today, the repeated warnings, the invisible data, the lack of definitions, I think we need to be skeptical.
Skepticism is the only healthy response. In a system like this, accepting recommendations is easy. Closing the loop is hard.
So here is a thought to leave you with. If a government agency accepts recommendations 5 times in a decade, but the audit findings remain basically the same, at what point does acceptance stop being a solution and start being a strategy to make the auditors go away?
That is the multi-million-dollar question, and the answer might be buried in a file somewhere that nobody has checked in 6 months.
Always check the receipts. Thanks for diving deep with us today.
Thanks for listening.